For far too long, what we've been doing has not been working, and we're taking, a different approach.
I'm here at the new 72-hour sobering center in Winnipeg, a place the province says will provide better care for those who are extremely intoxicated. While the idea has drawn political debate, the Manitoba government showed us exactly what the facility looks like and how it's expected to work.
The facility that's set to open later this month in the Point Douglas neighborhood will hold and monitor people who are intoxicated on meth or other long-lasting drugs for up to 3 days, expanding Manitoba's previous 24-hour detainment limit. The first 20 beds will open for people intoxicated by alcohol, with other substances added once doctors are confident in the new model.
With methamphetamine, the duration of use is longer, and there's other medical problems like electrolyte imbalances and those types of things that are more prevalent in patients who've used methamphetamine than with alcohol. So again, we want to make sure that those types of concerns are addressed and identified before somebody comes to this facility.
The center includes medical treatment, monitoring areas, and rooms where people can safely stabilize. Staff from Main Street Project and healthcare workers will provide care, with paramedics on site 24/7 and psychiatrists and addictions physicians doing daily assessments. For now, people affected by meth will first be cleared in hospital before being transferred instead of staying in emergency rooms.
We're not rebuilding a hospital here, but we are building a care facility that's targeted, as Dr. Bolton said, to support the needs of patients that have used methamphetamine.
The province says the goal is to ease pressure on ERs and offer a more human alternative to police cells or so-called drunk tanks, while also putting a focus on connecting people with detox, treatment, and housing support when they leave.
It's an opportunity for people to have their lives changed and for them to get connected to the care in a way that they haven't been able to on other substances.
However, the 72-hour model has faced some political pushback, with the opposition seeking amendments like annual reporting and restrictions on future sites, but those changes were voted down. The province says built-in safeguards, including regular monitoring and mandatory 24 and 48-hour health assessments, keep the approach centered on care rather than punishment.
Everybody is checked on every 15 minutes to ensure that they're safe. If the paramedics identify someone that they're concerned about, those checks are even more frequent.
The sobering center is expected to be fully operational by December, with plans to add more beds in the new year and eventually expand the model to communities in Brandon and Thompson. In Winnipeg, Mitchell Ringos, City News.